Yes, of course, it's still IKD 106.1 FM. Today happens to be the 20th day, yes, of course, the 20th day in the month of July 2023. A very good way to welcome you to The Issues on IKD 106.1 FM. The Issues is that program that talks about matters around our society, our community, and our nation at large. But every Thursday has been set aside for healthy conversations, and this is in line with General Hospital Ikorodu, making you to stay healthy as much as you can. And that is why we always have General Hospital Ikorodu join us in the studio every Thursday morning from 11 up until 12 p.m. Today will not be an exception, where we look at another very beautiful and important conversation. And of course, on the show today, I advise that you learn as much as you can, because I have a doctor in the studio who sure knows our onions well. When I say she knows our onions well, I can say that over and over again as we have our conversation around dental caries, the causes, stages, and treatment and preventions. Do not be surprised that this is one disease that has killed some people ignorantly, and they do not even recognize the fact that this could be a deadly disease. However, today on The Issues, you can listen to us from anywhere all over the world via our website, which is www.ikd1061fm.ng. That is, if the frequency is not too good wherever you are, listen to us from anywhere all over the world. You can also join the conversation via Radio Garden IKD 106.1 FM. IKD 106.1 FM. My name is Okpeyemi Adebambo. I'll be your host for today, and my guest in the studio is no other than Dr. Mrs. Kehinde Osinaike, all the way from Ikorodu General Hospital. She happens to be the head for the dental clinic department, Ikorodu General Hospital. She'll be my guest today while we talk about dental caries, causes, stages, treatments, and preventions. Stay tuned. After this very short breather, we return and we dive straight into the conversation. Good morning. You're welcome back to The Issues. Like I told you, my guest today in the studio is very much ready to teach us, and I, for one, I can tell you I am also ready to learn. I remember some times ago she actually taught me to always change my brush in 3 months or thereabout. Yeah, so I kept that in my head, because I used to feel like if the brush is still okay now, what's the point? And sometimes I just need to boil it with hot water, and then then all the germs are gone and I can use my brush again. But then she told me, hey, no, don't try that. And since last year, I've been doing just that. Sometimes even 2 months actually. So today again, I have Dr. Mrs. Kehinde Osinaike in the studio, and together we would have the conversation around dental caries, causes, stages, treatment, and prevention. Doctor, good morning.
Good morning, sir.
It's good to have you in the studio.
Thank you very much. It's always nice to be here.
I must tell you, looking good as always.
Thank you.
Yes, please. So when we talk about our focus for today, dental caries, causes, stages, treatment, and prevention, you happen to be the head dental clinic for Ikorodu General Hospital, which means that you'll be able to do justice well to the conversation. But to start with, unlike other parts of the body, you know, the teeth is just one part that might not be too troublesome, let me put it that way, might not be too problematic, unlike other parts of the body where you need to every month do one or two things, take care and all that. Sometimes we just neglect the teeth and feel like the only thing we need to do to the teeth is just brush the teeth. So to start this conversation, doctor, tell us, how important is it for us, and how often is it for us to always check our teeth medically this time around, not just to brush the teeth alone, not just to check the mirror and do how well is important for us to often check our teeth with a dentist?
So unfortunately, like you said, that is what people say.
Yeah.
That the mouth is a part that you should not pay as much attention to as all the other parts of the body. But I would like to tell you that the mouth is actually the gateway to the body.
Is the gateway to the body.
Yes, because everything we eat, everything we drink goes directly into the body. So we need to take care of the mouth. Taking care of your mouth and taking care of your teeth is also taking care of the rest of your body. So you must take care of your teeth, you must take care of your mouth, you must take care of your gums. So the mouth is made up of not just the teeth, but the gums, the tongue, the palate, every part must be taken care of. And so that's our advice, is that we tell patients that you should actually visit the dentist minimum of twice a year. whether you have pain or you don't have pain.
Twice a year.
That means every 6 months. So that means that if you come to the clinic in January, that means you set your alarm or set a reminder that the next time you should visit the dentist is the next 6 months. Why do we say that? Because there are some things that you would not see, or there are some things that not everybody opens their mouth to look into the mirror. But when you come into the clinic, we look at everything. And because our eyes are trained to see what other people's eyes are not trained to see, we'll be able to say, oh, you are fine, we'll see you in the next 6 months. Or we'll look at it and we say, oh, you have a hole here, or you have this here, or you have bleeding gums, and everything. So we advise, if you have not been doing that, we advise you to visit us every 6 months. Whether you have pain or not, in respective of that, because the only time a lot of people think of a dentist is when they have pain, which is actually wrong. By the time you're coming to the dentist when you have pain, you are almost coming a little bit late. Yes.
I see a very big teeth, actually a big mouth and a big teeth in the studio this morning. Yes, a very, very big one. For those of you at home, you're missing, but then I know my doctor will do justice to the conversation well enough, and I also want to learn with this big mouth in the studio. I know this one can consume a cow. Anyways, going straight into the conversation now, there are a lot. While I was taking my time to do a very brief research on some oral diseases, I discovered that there are even more than 5-10 oral diseases, and I was surprised personally. I was like, oh really? Well, I think maybe just 1 or 2 could have been the major oral diseases that we could have, but seeing over 10 online, that makes me feel like, oh, so there are more. So before we even start talking about one of the majors that actually could even take lives if care is not taken, which is the dental caries, tell us some of these oral diseases that often occurs in the mouth of we human.
Okay, so as I said, the mouth, like I have this model here, it contains the teeth, it contains the gums.
Okay.
Now the part you can see here,
that's the tongue.
This is the tongue. Yes, this is the tongue, and then up here is the palate. That's up there.
Oh, that's what it's called, palate.
It's called the palate. Yes. Wow. Now the part of the tooth that you can see, that is just the outer part.
Okay.
We have some part of the tooth that is inside the gum, which is where you have your roots. You have your roots and you have your pulp chamber.
Okay.
All right. So all those things can be affected by disease. Your gums can be affected by disease. So you have people where they will tell you, oh, when I'm brushing, I bleed. Yes. It is abnormal for you to bleed when you are brushing. That means that your gums are diseased. Some people will tell you, oh, my teeth are drifting. My tooth used to be here before, but I notice now that it has moved to one side.
Yes.
That means that what has happened is that the gums have been affected, and also the roots. It's like a tree.
Yes.
So you have the root. Most of the time we don't see the roots. That is what is under the soil. Okay. So when you have infection getting to the roots, you find out that people will just say, oh, my tooth is shaking. Yes. It was not shaking before, all of a sudden it's shaking now. Shaking. Yes. So that means that the disease is getting to the roots. And then you have patients that will, so the inflammation of the gums, or the infection that has that it's from the gums is called gingivitis. Because the medical or the dental term for gums is gingivae. So when anything that is inflamed is itis, so that's gingivitis. All right. Then we also have, of course, cancers. We also have cancers in the mouth. Wow. We also have, yes. Then we have oral thrush. We have so many we have periodontitis. Periodontitis is that, so the part of the tooth that is inside the gum is held together by something like, maybe we call it like a thread, but that thread is called your periodontal fibers. So they are the ones that keep your tooth in place so that your tooth do not shake. So when those fibers are affected, then when you have that part being affected, then you have periodontitis. Then we have the acute. Acute is short term, and then we have the chronic, which is long term. So we have so many things that can happen in your mouth, in this little mouth. You have so many things, and you also have some diseases that the first place you will see it is in the mouth. Remember, I said that the last time I came. Yes. And that's why we say that the mouth is the gateway to the body. Sometimes you have things happening in the body, and from the mouth alone you can know. For example, I think I told you the last time was, you have some patients when they come, all their teeth are shaking. More than 3, 4, 5 of their teeth are shaking. And the first thing we'll say is, okay, go and do your diabetes test.
Wow.
And most of the time, they come back and they have issues with their sugar.
So from the mouth, one can also
from the mouth you
discover.
Yes, you can discover some issues that patients have in the body. Yeah.
Thank you very much, Dr. Kehinde. This conversation is going to be very interesting. You've heard that. So when you think that the mouth is not so important for you to care for, you should know that you're mistaken. So now let's talk about this oral disease called dental caries, which is like the very commonest of all of the mouth disease. How best, as a doctor, can you define this disease called dental caries?
Yeah. So to simply define dental caries,
yes,
I will call it cavities, or I will call it holes in your teeth.
Okay.
That's simply put. So if you have holes in your teeth, or you have what we call a cavity in your teeth, that is dental caries. So that is simply put. So if you look in your teeth, or you feel that sometimes you are eating and you have food getting stuck inside your teeth, that is what is called dental caries.
Wow. So that is the simplest form to
That's
just put
the
it.
simplest
When you
form.
see holes
in your teeth, dental caries.
then there is a problem.
Yes.
Some will tell you that when there are holes in their teeth, especially the older generation, our fathers and our mothers, our grannies, they'll tell you it's just old age. It's normal. It's
so
fine.
now there's a difference.
Okay.
You can have holes in between.
Okay.
So they will say, oh, when they're eating, they have food getting stuck in between their teeth. That is different. Dental caries is when you have holes in
the teeth.
Inside, yes. And it could be on any side.
Okay.
Yes.
Okay.
So we have different classes, of course, but that's too advanced for here. But on inside, this is the tooth. Yes.
Okay.
You have holes there.
It could be on top, beside,
it could be on top,
anywhere.
It could be beside, yes.
So if there are holes, then there is caries.
Yes.
Wow. That's serious. So let's talk about this is amazing. Let's talk about some of the things that causes, because if there's a hole in the teeth and there is no sledgehammer anywhere or somebody punching the teeth, it's not as if you're trying to pierce the teeth and there are holes in the teeth, then there is a problem. What causes this dental caries?
Okay, amazing. So everybody has bacteria in our mouth. Everybody. And they call them the normal flora.
Even those that
everybody. Those are the things that God has just put them there. You know. Now, bacteria, they are living things, and they must feed. All right. Now, when they feed, they produce what we call acids.
Okay.
And we all know what acids do. Acids destroy.
Yes.
Right. Now, and that's why we tell people you need to brush in the morning. And you need to brush at night. So you have eaten, you don't brush at night. You know that you have given the bacteria in your mouth lots and lots of food to eat. And so they feed on the food, the remnants of the food in your mouth. And then they produce acids.
Okay.
And what do these acids do? They destroy your tooth. And they begin to form holes in your teeth. And so that's why we say you need to brush last thing at night, so that you don't give those normal bacteria in your mouth anything to eat. You don't want them to eat.
Stop
you don't
them.
Want, exactly. Because once you keep food in your mouth or eating in between meals.
Okay.
So you've had breakfast and then you want to snack on meat pie and then you want to drink Coke. You can see that you're giving them normal bacteria lots of food.
They are going to live so healthy.
So they are going to have a field day. And what they do is that they produce the acid. So it's actually the acids.
The bacteria produce the acids.
Once they produce those acids, what they do is they now begin to eat on your teeth, which is called demineralization. So they begin to destroy the teeth. All right? And then especially if you see the shape of the teeth, you have the smooth. It's not smooth. The top of your teeth are not smooth. They call them occlusal surfaces.
Okay.
They're not smooth. You know, and some of the culprits are those sticky foods. Some of us like eating the very, very ripe plantain. So when you eat it, it sticks to all these surfaces. It sticks to all these surfaces, chocolates and all those things. They stick there and they remain there. And then the bacteria,
they find them there.
They feast on these things and they now begin to cause holes in your teeth. So that's one of the major causes.
Yes.
Of course, there are other causes. Poor oral hygiene. You don't brush You don't brush well, you know, of course. And when you brush, you need to brush all these surfaces as well, so that all the food that is stuck in all these places, you know. And then we have some patients that we say are susceptible to having this thing, because that means that they are more likely to have. Why? Because for some people, you find out that the surfaces of this of the tooth are actually deeper. Do you understand? They are deeper than this. Some people just don't have it very deep. Some have it, you know. So
it varies.
Yes, it varies. The depth, you know, actually varies. So when you have food that gets stuck there, some people are just susceptible to them. You know, yes. So poor oral hygiene is one of them. Eating in between meals, eating sticky foods, eating sugary foods. All those things can make you susceptible to dental caries.
So you talking about poor oral hygiene and not brushing well. This will bring me to my next question. These are some of the causes that brings about this caries to the mouth. How, when you say brush twice in a day, in the morning and at night, we have different forms. Some people, when brushing, you might think is a suicidal mission, you know, and then you're beginning to wonder what's the problem. They will tell you categorically and say, no, I have to do this much so that there will be no bacteria in my mouth. What's the best approach to, I don't know if I'm putting that question right, what's the best approach to brushing? Because some people, the pattern at which they brush could be scary, and all for the fact that they don't want to have those bacteria feast on meals in their teeth.
Yeah, amazing. So I brought this so I could describe how we could brush. First of all, your toothbrush must be a medium bristle toothbrush. Medium. And you are using a flouride toothpaste. So for your upper teeth, so this is how your tooth should be
closed.
But when you want to brush, you open your mouth slightly. All right, and you brush away from the gums. Always away from the gums. So that means if you are brushing your upper tooth, you are brushing down. Now, why are you brushing down? So that if there is anything stuck in between your teeth,
it pulls it out.
So you brush away from the gums. But what we have people doing is, this is the way they are brushing. And when you are brushing like this, you are traumatizing, you are wounding your gum. And the only way your gum, because your gum cannot speak, can tell you that, you are disturbing me, your gum now begins to move back. And that's why you have some people, when they come, you will see that the roots that we should not see, we are beginning to see them because it's been exposed, because you are traumatizing. And then you are brushing too hard. Our mouth, I tell people that your mouth is not a gutter that you have to scrub and
not
scrub
even a gene.
Exactly. So you just brush gently and you brush away from your gum. So when you are brushing your lower teeth, you brush away. So for your lower teeth, you are brushing upwards. And for your upper teeth, you are brushing down. You are not brushing sideways. Because if you brush sideways, anything that is in between here, you are further pushing it. Amazing. And then, of course, you need to brush your tongue. Many people don't brush their tongue. So you bring your tongue out and you brush your tongue.
Carefully.
You brush your tongue carefully. And then, of course, you don't only brush just this side. You also go to the inner part. Remember I told you the palate? You go to the inner part and you brush away from the gum. Away from the gum. Also for the lower here, you brush away from the gum. You need to do that. And then after that, and you must brush for a minimum of 2 minutes. And then
minimum of 2 minutes.
Yes.
Twice
a day.
You know, there are some places, you know, all of these are some of these are areas in Ikorodu, and you see a mother brushing the child's teeth outside in the morning. You think and you wonder, what's that
being done?
You can we've nearly turned the child upside down in the name of I want to brush away the germs in your teeth. So for those of you listening at home, you would have the opportunity to watch this video too as well. We'll get to that, but then remember, just like the doctor has rightly said, Dr. Mrs. Kehinde Osinaike, you do not don't pressure your teeth, don't pressure your gum, don't pressure your mouth when you're brushing. That aside, now let's come down to this caries, which is this deadly disease. When I was making my research, like I said, it was said that it has actually killed some people before. How true is this? How valid is this statement for caries to be that deadly? Could it be that deadly? Because the way you described it, you said it's the bacteria feeding on the tooth. How come? Why should it kill?
Yes. So there is a progression.
Okay.
Just like you have a stage 1, you have a stage 2, you have a stage 3.
Okay.
All right. So when dental caries, remember I said this is just the part of the tooth that you're seeing, the outer part. This is the enamel. The tooth has other parts. You have you have the roots, which is under, which you cannot see in this. All right. And then you also have your fibers that hold the teeth together. You have your pulp chamber. In the pulp chamber, that's where you have the blood vessels and the nerves and everything.
Yeah.
Now, I will say that to say this. So that's why when dental caries starts, there is no pain.
Okay.
There's no pain. You just say, "Oh, I have a hole in my tooth," and then food gets there, you remove it. After some time, because the hole is getting deeper, you now begin to have pain. Pain on, oh, when I'm eating, I have pain. Oh, when I'm drinking cold water, I have pain. Remember, it started from no pain.
Yes.
Then after some time, it's not only when you eat or when you drink water. All of a sudden, you're not doing anything. Spontaneous pain. And then you start having that pain. And then you now start having pain that disturbs you at night. That wakes you up at night. You can see that it's going deeper.
Yes.
So now, after that, it now passes into the pulp chamber, and then it now goes out the roots.
Okay.
And then it now begins to affect every other part. And then from that little caries, you now have a swelling, which we call an abscess.
Okay.
A dental abscess.
Okay.
Periodontal abscess. Remember I spoke about the periodontal?
Yes.
Yes. So it begins to affect all that. Now, if it remains untreated, which is usually the case,
okay,
it comes untreated, and then you now begin to have a massive swelling. And of course, because especially for the lower,
yes,
because it is right here, you now begin to have a swelling that spreads,
okay,
to this place, to the floor of the mouth. It spreads to the neck. And when you have a swelling in this area, it's going to begin to disturb breathing. Yes. And that is the case. And so you have patients that come and say, it's just this. And so that's why we tell people, please do not neglect. Do not neglect all these things. Once you have a hole, not even when you begin to have pain, once you have a hole, please come to the dental clinic. The earlier it is treated, the better. But what I see, we have people that come and they will say, oh, muloyo akokoro. Yes. That's what they call it, akokoro. They will go to the malams on the street side and they will say, oh, they put something in their mouth and they brought out some germs. Of course they will bring out germs because those are the normal germs that I told you, that are the bacteria that they live there. So of course they will bring out something. And so they bring it out and then you feel better, and then 3 weeks later you have something
back
else.
To square one.
You're
or
back
even
to square
worse.
one. Yes. So the only thing is, and of course, the earlier you treat something, the cheaper it is for you, and the better it is for you. So yes, we have people, but it is a sequelae. That means it's a progression. If you allow it to progress, yes, it can get that bad. Yes.
Okay, so Dr. Kehinde, thank you for that enlightenment. Some people, when you were talking about pains the other time, you said it starts with almost no pain, and then you discover that it's becoming this. It reminds me of some people that will just tell you that while I was trying to pick out the pieces of meat from my food, I just mistakenly pinched my gum. And then how best can we, we can't wait until night time, maybe when we're in a party and it's all rosy and there is jolly and all of that, and then you see there's a meat hanging somewhere or a piece of whatever hanging somewhere. How best can we get rid of these things? Because some people, toothpick, all these sharp objects becomes the problem, and then it creates a pain and all that. How best do you think we can attend to all of this attache in our teeth?
Okay, now that is food in between your teeth.
Yes.
Remember,
yes.
That is not dental caries.
Yes.
Okay.
Yes.
So when you have food in between your teeth, yes. So we tell you to use dental floss. I didn't bring it, unfortunately. Okay. Dental floss. Maybe next time I'm coming.
Okay.
So there are two parts of the dental floss. There is the sharp part, and there's the part that is like a thread.
Okay.
And there's some that is just the thread. So what we advise you to use is to use the dental floss, the thread part. So you put it in between your teeth. Of course, you're not going to open your mouth in public and do that. Of course, we'll tell you to, to be decent and and do it. So you put it inside and then you pull out. So we advise, please do not use toothpick. Because what happens is when you're using toothpick, for those that use toothpick, some people even use broom. When you put it there, it's very, very, very nice. You feel very nice. And as you're doing it, you're just, you're just poking.
It's so good picking out.
It actually feels very good. Yes. But you don't know that what you're actually doing. Remember, I told you about the fibers that hold your teeth together.
Yeah.
What you're doing is you're destroying those fibers. You're destroying them, by picking and picking and picking. So please, we do not advise us to use toothpick. We advise you to use dental floss.
That dental floss, for those listening, is that it is to share in party. Because I know they shared a lot in party. And the funny thing is that we've not been seeing this thing in existence like until maybe 2-3 years ago, where it started becoming very rampant.
More like people are getting more aware.
The awareness is becoming better. So it's advisable we use that method instead of the original toothpick thing or sharp object. So let's talk about the stages of this dental caries. I believe there are stages to them. Just like you've mentioned it briefly the other time. Yes, but then for the betterment of our listeners out there, for a clearer understanding, just like we have oral diseases, they are in stages as well. Let's talk about clearly the stages for this caries when we talk about this deadly disease called caries, because it's deadly as well.
Okay, so as I said, I've described it already. Yes. There is no pain. By the time you start having pain, that's called pulpitis.
Okay.
You have pain when you eat. You have pain, and immediately you remove the food, you are better.
Okay.
Immediately you remove the food, or you stop drinking the water that was causing the pain, you are better. Right? That's pulpitis. Now, it can be reversible or irreversible. Reversible is when you remove whatever is causing the pain and you are fine. That's reversible.
Okay.
You are still good. By the time you start having irreversible, that means that even when you have removed the food that is stuck in that cavity, you are still having pain. It has become irreversible.
Okay.
That's irreversible pulpitis.
Okay.
All right?
Okay.
Then after that, you now begin to have, when it now begins to go down, you have your acute, periodontitis. That means it's affecting the periodontal fibers. Remember I told you that there's acute and there's chronic. So you have all that, and then you now begin, when it now passes all that place, you now begin to have your dental abscess. You have and then you now have the big one, which is the big elephant, is the Ludwig's angina. And by that time, it's actually very bad. It's actually very bad, but not all. And that's why presentation early is very good. Early presentation. So no matter at what stage we ask you to please present early, and the earliest time to present is when you have that hole in your tooth that does not cause pain.
Let's talk about the treatment, because definitely you are a doctor, and with your wealth of experience in the game, you would have done this several times in treating this caries. But I would ask, does it have anything to do with the age? Is there age?
I was going to say that.
Because, I think children will grow to a particular age where they change all their teeth again. So maybe if a child has caries, it should just wait until when the teeth will remove, and then the better ones will. Okay. So what are the...
children do have caries.
Wow.
Yes, children have caries.
Wow.
There's something that we call early childhood caries. It used to be called rampant caries.
Okay.
And how does this happen? It happens. So mothers, I want you to listen very well, especially breastfeeding mothers.
Okay.
We have mothers that go to sleep with the baby sucking. Remember that what they're sucking is milk, and milk contains sugar. So that means that as that baby is sucking through the night, because you don't want the baby to disturb you, so you leave either the feeding bottle or your breast in the baby's mouth. You find out that after some time, that child is going to have caries. Because that means that there is sugar in the child's mouth virtually the whole time. If let's even say we sleep for 8 hours, so that means virtually 8 hours, that child's tooth is in contact with sugar. And so, but for the children, because their teeth are still small, is actually it's faster, because their teeth are still very small, and so you have the caries affecting 5-6 teeth at the same time.
The tooth are still very tender, so it can penetrate easily.
Yes.
Yeah.
So please, we advise mothers, breastfeeding mothers, do not leave your breast in your child's mouth, and do not leave the feeding bottle in the child's mouth.
Thank you.
We don't want you to do that, please.
We'll take in calls. I see some of us will have 1 or 2 questions to ask. We'll take in calls on the studio line 0904-081-1061 or 0904-082-1061. Please, I beg of us to ask questions in line with our conversation today. Dental caries, causes, stages, treatment, and prevention. Just so you know, again, my guest in the studio is from General Hospital Ikorodu. She happens to be the head dental clinic for that department, Dr. Mrs. Kehinde Osinaike. I would like for us to talk about how we can treat this disease that affects the mouth. How can it be treated? Because I know there are people out there that would want to know how best can we treat these caries.
Okay, amazing. So to treat, as I said, you do not treat dental caries on the roadside.
Okay.
You do not remove akokoro because those are things that happen, especially in this area. So what you do, visit the dentist minimum of twice a year.
Okay.
So now you have the dental caries. What do? You come to the dental clinic, we check your teeth, we do x-rays, we take radiographs to find out how deep is this hole, remember? To find out how deep this hole is. If the hole is not too deep, maybe it's still, when it's still reversible,
okay,
we can fill. We can do fillings, and we have different types of fillings. We can fill. Now, when it becomes really bad, we have what we call a root canal therapy. That means that it has gone into the root. So we need to now treat, the pulp. It has gone into the pulp chamber. I told you that's where the blood vessels from our biology. So we treat all that. All right. Now, sometimes it gets really, really bad, and we have no choice. The hole has become so big, and it has taken more than half or more than 3/4 of that tooth. We have to extract that tooth.
Wow.
Yes.
Wow.
So those are the stages. You have a normal feeling, and I said there are different feelings. Sometimes it's, we have to put a temporary feeling before we now put the permanent one. And then, of course, we can now do the root canal. After the root canal, we can now crown the tooth. And if the tooth is really, really, really bad, we have to extract it.
So there is a stage where one could feel the teeth.
Oh yes, oh yes, oh
wow.
yes.
Wow.
There is a stage, and so that's why it's surprising that people will still keep the hole there and they will not come to the clinic. So please, viewers, if you have a hole in your tooth, come to the dental clinic.
Yes. Then how long can these caries stay before one can? Some people just tell you, my kind of job. It's not just, let me use myself as an instance. I almost do not even have the time to do other things, and then one dentist is telling me to come and fill my teeth with medical cement or something.
I love that question. I love that analogy, and which is what I tell people. When that pain grips you,
you'll find the time.
You will find the time.
0904-081-1061 or 0904-082-1061. So the best answer to that question is don't wait for that pain to get so bad. Find the time as much as you can, and we hope that you would also always be available for people who comes around.
Yes.
How often do we have people come around to check their teeth? How often do we have people come treat this dental caries?
Oh, every day.
Every day.
Oh yes, we have patients that come every day.
So dental caries is this?
It is
common.
It is. It is very, very common.
Wow.
Very, very, very common.
Wow.
Yes, because that's the first stage. So it is common. It is common. So we advise you to come in on time. But we also advise you, don't wait until you have that cavity before you come. Just come for your normal cleaning, your normal scaling and polishing, and you're home and drying.
Nice.
Yeah.
I like that.
Because when you do that, you actually give us, we are happy with you. It just shows that you are more aware about what is going on in your mouth. Yeah.
Thank you so very much. The issues on IKD 106.1 FM today, we focus on dental caries. This is another deadly disease. Hello to you.
Hello.
Yes, good morning. I need you to turn down the volume of your radio set or you turn it off.
Okay.
Oh, you are in a noisy environment. Go ahead. What's your name?
My name is Friday.
Friday, calling from where?
Ikorodu.
Go ahead, Friday. Talk to me.
Please, my question is, how can one make, let's assume that your teeth is brownish.
Is what?
You want it to be brown.
Oh,
brown.
Okay.
Yeah, and you want it to be white. I think.
You want your teeth to be white.
Yeah.
What can you do to it? Okay.
Exactly.
The doctor will attend to you. Thank you very much.
Okay.
Thank you very much. So Friday from Ikorodu is asking you, Dr. Kehinde. He's saying that if you want your teeth to be white, you just want the thing to. I think I like that question. Funny enough, I just want my teeth at least like your teeth is. I brush my teeth twice in a day since the last time we talked, and it's still not white, and your own is white. How can we do it?
So, Mr. Friday, thank you for calling in.
I want you to take two questions at the same time. Hello.
Hello, good morning.
Yes, good morning, please.
My name is Mr. Ayonda from Ebute.
Ayonda from Ebute, go ahead.
Okay. So I want to ask, what is the cause of mouth odor?
Mouth odor.
I noticed such thing, at least for some of my children, they will brush in the morning, brush in the night, but at times I will see passive mouth odor from that. I ask them, you did not brush very well. They brush. They can't brush. But yet, mouth odor will
still be there.
Yeah.
Thank you very much. Thank you. Your question will be attended to. Thank you. 0904-081-1061 or 0904-082-1061. Before we take in more calls, let's attend to those two questions. The first one is saying, how can my teeth be white? I want to know that one too.
Okay, so it depends on what is causing the discoloration. Some people, the discoloration is poor oral hygiene. They do not brush well.
Okay.
Or they brush many times, but they don't brush well.
Okay.
There's a difference between brushing many times, but you're not brushing in the way you should be brushing. Remember the way I described it? If you're not brushing like this, you're just brushing. You're not
just like
brushing
a waste of time.
Exactly. So it depends on what is causing the discoloration. It might be poor oral hygiene. It might be cigarette smoke. It might be.
So those who smoke too.
To those that smoke, yes. You find out, yes. So to those that smoke. All right. Then for some people, there's something that we call, so the ones that, for like this for example, the poor oral hygiene, we call it extrinsic stains. That means there are stains that affect the outer. The outer, just this part. But we also have intrinsic stains. We have people that maybe when they were much younger, they were ill. Of course, in those days, our parents did not know too much. And so they gave us some drugs, like especially tetracycline is a culprit. And so they have stains as the teeth were developing. So those stains are called intrinsic stains. And you see them, they affect most of the teeth. So that's why I said it depends on what is causing that stain. But the only way we can know what is causing that stain is for you to come to the clinic and let us see. Some of us take lots of food that stain our teeth. Some people take lots of tea. They can't live without taking tea. They can't live without taking coffee. It's fine to do all those things. But we tell you that, try to rinse out after, and as well when you come twice. Some patients, we tell them to come more than twice. We tell you to come either every 4 months or every 3 months if the case requires that. But minimum, if you're just minimum at least twice a year.
Least twice a year.
Yes.
Okay, so for Friday, who asked that question, go to General Hospital Ikorodu. When you get there, ask of the head for dental clinic. Her name is Dr. Mrs. Kehinde Osinaike. She will attend to you. Tell her you're from IKD FM. So the next question, this man is asking the question, my children always brush their teeth regularly, but yet this mouth odor, what's the problem? What's the cause?
Also, they have different reasons why a mouth would smell. It's called halitosis. Mouth odor is called halitosis. It's called, smell from the mouth. Now, one of them is poor oral hygiene. So you can see that we're coming back every time to poor oral hygiene, which is the basic thing. If you don't take care, anything you don't take care of will be dirty and it will smell. If you don't take care of your shoes will be dirty and they will smell. So as well with the mouth, if you don't take care of your mouth will be dirty and they will smell. Some people take lots of spicy foods. If you take suya now with lots of onions, after some time your mouth will smell.
True.
Garlic. So it depends. So I don't know what kind of smell you're talking about. And as well, what time of the day. Everybody, no matter who you are on the face of the earth, when you wake up in the morning, if you smell your breath, you don't want to smell your breath.
True. Because
what happens is that during the day, and that's why, God is such an amazing God, because everything that God does is for a reason. So we have saliva in our mouth. And what does the saliva do? The saliva, as I'm talking now, my saliva is washing my mouth. Okay. Because I'm producing saliva and it's washing my mouth. And that's why you have some people that chew. They would tell some people that have maybe like dry mouth, chew gum, take frequent sips of water. Why? Because you want to keep your mouth lubricated at every point in time. So going back to this issue of when you wake up in the morning, because you are not talking, your saliva is not moving, nothing is happening, the thing is just there, your mouth is closed for 8 hours. Not functioning. And then you suddenly open your mouth. Oh my goodness.
It will smell.
You don't even want to smell your breath in the morning. All right? So that's one. So that's why I said it depends on when you are smelling your children's mouth. Of course, when you are fasting as well, you're fasting, you are not eating. You're not eating, you are not drinking. Your mouth is dry. And most of the time, you don't want to talk much. So you open your mouth and you have that odor. All right? For some people, remember we spoke about the holes.
Yes.
When you have holes in your teeth, food gets stuck there. And there's this analogy I like to give. If you have bread and you cover bread for days, after some time, the bread becomes moldy and begins to smell. So let's say that you have those holes in your teeth and food gets stuck there and you don't brush well. After some time, that hole, the food that you bring out of that place will now begin to smell. If you try it, for those that have holes in there, when they bring it and they smell it, it doesn't have a good smell. So all those things come together. And of course, there are some other illnesses, that cause, that produce ketone bodies. But I mean, that's a bit too advanced for here. But all those things cause the mouth to smell. Now, there are some people that the smell is just in their mind.
In their mind?
Yes.
How, please?
It's called psychogenic. So there's some people that will come... When I'm talking to some people, they're always doing like this. So I feel my mouth is smelling.
Okay.
And then you tell them, are you sure? Maybe the person just has a habit of doing this. And there's no way you can convince that person. And you tell them, your mouth is not smelling. You will call 3 or 4 other doctors, come and smell this. There's nothing. So it's in their mind. So for some people, it's just in their mind. And when you probe deeper, you find out that they have 1 or 2 issues, that are going on in their lives. So it's called psychogenic halitosis.
2 more questions before we leave. On our platform, on our social media, some people want to know when we talk about the caries. Is it something contagious? I'm thinking right now that maybe, for instance, a man has it, the husband, let's use a good example, I don't want to say boyfriend. So the husband has it already, and then the wife is also there at night, normal, they have to exchange leaves. Is it contagious? Can the thing just fly from?
No, it cannot.
It cannot fly, so it's not contagious. No, let's take another call. Hello to you. Good morning. Good morning. Good morning. Your name? Oh, beautiful. Go ahead.
I want to ask, is there any, aside from toothpaste, is it hygiene for children to wash mouth with baking soda or
salt?
Or any other thing?
Okay. Yeah, the doctor would attend to you. Thank you, ma. Thank you, ma. Okay. I think she reminded me of another question there. Some people will tell you there's no paste right now, it has finished. And the condition of the country now, we used to buy paste 150, now it's now 600. But we have enough salt in the house. We even have 1 liquor salty that you just need to pour on your brush. Is it hygienic? For her, she wants to know.
Okay, so it's better to use fluoride containing toothpaste. I'm not going to mention any names.
Oh,
but
definitely.
Fluoride. So when you go and buy your toothpaste, just check, does it contain fluoride? Now, just in case you say, okay, I don't, you can use chewing stick. You can use chewing stick. If you think that things are quite expensive, then you can use chewing stick. But you must have chewed the area to make sure it is soft, so that it does not wound your gums.
So chewing stick is acceptable.
Yes,
actually.
there are different types. There is Oriata. There are so many of them. Yes.
Okay, that is that. One more message from our social media platform, and then we call it for a day. This person is asking, maybe I guess this is our first caller, maybe Friday, saying that are some people born with brown teeth. I think that is similar.
I mentioned that. I said it.
I think it's similar to some people are born with brown teeth. So what
happens is that, okay, as I said, the mother had a very bad illness, and she was giving some antibiotics while she was pregnant for this child. And remember that the different stages, the tooth does not come out when the tooth does not begin to form when the child is born. The tooth has begun to form even in the mother's womb. So if those antibiotics now begin to affect the teeth at the time they are developing, by that time that child is bringing out the teeth are discolored.
Okay, so before you leave, for those that are not in the circle of the dental caries right now, what would your advice be to them in order to prevent this disease coming their way at all? What's the best measures as which we can prevent? Of course, definitely it will still boil back to our oral hygiene. But please go ahead and give us a proper explanation on that.
It looks like you're a very good student because yes, it boils back and it boils down to you need to maintain good oral hygiene.
Oh yes.
Brush twice a day. Try not to eat in between meals. And if you want to make sure you eat your food close, your snacks close to when you have your normal meals. All right, then visit us in the clinic. Let us be the ones to say you are fine, rather than you going about to other places, because prevention is better than cure. How do you prevent having dental caries? Good oral hygiene, brushing with your flouride toothpaste, change your toothbrush every 3 months, or when the bristles become splayed. If they become splayed after 1 month, please change it after 1 month so that you know that you are brushing well. And then visit us in the clinic for professional cleaning, which is called scaling.
I like that word, for professional screening. Now, your advice to couples out there, lovers out there that will just tell you that I love my husband, I love my wife, and this love is as good as we share the same brush. What do you have to say to these people? I know you didn't see that coming.
Honestly, I think my advice
it happens actually.
Oh yes, I know.
It does. Some people tell you, I love this man so much, we don't even care. We share the same towel, we share the same brush. In fact, we share...
But we shouldn't share the same toothbrush.
Medically.
You shouldn't. That's my advice. Have your toothbrush. For the lady, you can have a nice pink toothbrush. And for the man, you can have a nice blue toothbrush.
Why pink? It's a lady's thing. Oh, okay.
But really, just like you have your shoes, then you should also have your own toothbrush.
Yes. You've heard that from Dr. Mrs. Kehinde Osinaike. I want to say thank you so very much. It's always nice having you in the studio. It's always nice having you in the studio. And again, I need you to emphasize to those out there that you are very much available. I mean, General Hospital Ikorodu to attend to medical issues in line with our mouth, our feet.
Yes. Before I do that, I also want to mention something that I said I will not forget.
Okay.
Many people, when they begin to have this dental caries and they begin to have pain, there's something that they buy. It's called touch and go.
Touch and go.
Touch and go causes more problems. So please, what happens is that touch and go is like an acid. Okay. It's like you're putting an acid directly on your gums, and so it burns the whole gums. So by the time they are coming to the clinic, they, apart from the dental caries, they also have what we call chemical burns. So please avoid touch and go like a plague. Don't even go near it. Don't go near it. And so I said that to say that we are very available for you in the dental clinic. And you're welcome to always come and visit us in the dental clinic. And you don't have to have pain. You don't have, just tell us, I just came for a routine checkup, and we'll be very happy with you to come. Thank you very much.
Thank you very much, Dr. Mrs. Kehinde Osinaike from Ikorodu General Hospital. This is how far we can have it today on the issues. Talk about a healthy conversation that comes up every Thursday. So do well to join us next week Thursday again, as we would have another doctor from General Hospital to orientate us, of course, about our health. My name is Okpayemi Adebambo, urging you to have a beautiful day ahead of you. Remember, health, they say, is wealth. God bless you.